Okay, thanks for joining me in another episode of Policy in the Wild. Today, I have asked my friend Robyn Rapoport from SSRS to join us today. Robyn and I met many years ago working on a policy project having to do with veterans. And so Robyn came in, has a very deep expertise in methodology and polling, and was able to help us get some policy answers through a polling survey that we did with her. And so I thought she would bring a unique perspective to our class and our understanding of policy. So first, Robyn, thank you so much for joining me today.
Thank you so much, Eva. It's so much fun. I was really excited kind of thinking about this ahead of time too.
Awesome. So first, will you start, Robyn, by just telling us what kind of company SSRS is and what you all do?
Yeah. So SSRS is a full service, we say social science and market research firm. And we've been leading and redefining research for more than 40 years. And our team designs and implements research solutions to complex, strategic, tactical, public opinion, and policy issues in the US and really across the world. And we have a wide range of experience with all facets of data collection, including qualitative research, multimodal survey research, and mixed method approaches. So yeah, it's kind of the full gamut of research.
Perfect. So, including you mentioned qualitative as well. So I know you mostly from the quantitative work, but then just a little bit more about the qualitative services that you do.
Yeah, so that's actually that's an area that I'm so proud to say I've been like a strategic leader at SSRS and bringing to SSRS. My background actually was originally in anthropology, cultural anthropology. That was where I had done my PhD coursework. And when and the first position that I had, that was sort of as, life happened and my kids were getting older and I needed to be working very full time. The first position I had was doing pharmaceutical marketing research, and it was more qualitative than quantitative at the time. But I, have always had this appreciation of what you can learn by talking to people and really being able to ask rich questions. And when I was in graduate school, it was really about like, how do people think about things? You understand, you learn about the how, you understand more rich information, but the downside of like the upside of qual is that richness, and the downside is that you can't generalize it. So it's the benefit is when you can bring them, or a benefit, right? Sometimes you can just do qual, sometimes you can just do survey work. But even when we just do survey work, we really try to encourage our clients to think about qualitative components, at least pre-testing surveys, because we can learn so much from that as a kind of qualitative component. And oftentimes nowadays, as research is just becoming more and more expensive and more challenging, we're seeing qualitative research sometimes having a benefit being used on its own in very thoughtful and intentional ways, or being used to help inform the design of your survey instrument, or help you understand some of your, like the richness of the findings, you know, when the aftermath. Like, so say you find some weird stuff, and you want to know more about people that say they hate their primary care doctor or something. Why? Or people that are really satisfied or dissatisfied in ways that you wouldn't necessarily expect, or this, that, and the other, or certain subpopulations that you just don't get large numbers of, but you want to understand more about their specific experiences. So there's just a lot of ways we're using them more and more. So this was something that I've been passionate about, and I've been doing since I came to SSRS, but it's been something that I was able to really lead our kind of expansion strategically into by bringing somebody on to be managing it in-house for us.
I love that, and we'll dig in more to those research aspects when it comes to policy in just a minute. But one more personal question: so, how did you get from cultural anthropology to the executive vice president of public health and policy research and strategic initiatives? If I have your title right, at
Yeah,
SSR.
for like no, I think healthcare, public policy, something like that. But in any case, so how did I get there? Right. So part of it is what I was saying, that that I had a big really a generous gift from my parents was I had an amazing undergraduate education, and a gift of the University of Pennsylvania was I had a really strong graduate education. And I've always wanted to do things to make a difference in the world. My father ran a hospital system. He was a physician. My mom was a therapist. So I've always wanted to be doing things where I felt like I could help do good in the world. But along the way, I think what happened was, our kind of financial life situation shifted at a time at which I was already looking at what was next. I'd been doing part-time things. I ran a research project. I did qualitative research as part of a research project. I did various different things kind of part-time. I did a lot of volunteer work. And then we had a time where I needed to basically be able to be providing the primary financial support for our family, and I needed to have a health plan. And the nature of, the US system is such that you just don't have healthcare otherwise. And so I was ready to really look for something very full time, or I needed to take on something full time. And one of the things that I had learned when I was in this process of thinking about this was I didn't finish my PhD. I didn't actually get I'm not ABD either. So I didn't do my orals or whatever it was, but I had completed my coursework and I did do a master's paper. And so I had this opportunity, to attend through the University of Pennsylvania. Like, what do you do if you're like ABD or whatever it is, and it was a great kind of program that they were like, well, there's certain things that people are really good at when you have done, kind of social science research. And one is you're good at research and you're good at thinking about like a lot of data and making sense of it and finding patterns. And so one of the things that often people that have backgrounds in cultural anthropology do is they think about market research. And I didn't know what I was doing. I was like, but an opportunity presented itself. And lo and behold, I had never done a PowerPoint presentation. I had to do one for this project, at a full day of interviews, including like presenting on like research I had done. So I had to do that. And then I got this job and it was a full-time job and it was I knew I liked healthcare because they were asking me which field. And I was like, oh, healthcare. So I was doing pharmaceutical marketing research and I worked with really smart people who did really good work. And it was really interesting in a way. And some of it was fascinating. I mean, I did all this work on like the whole kind of kidney transplantation process that was fascinating. I learned, and I talked to a lot of doctors, different specialists, and did and got very good training. But I still remember, and I'm sure I told you this, I still remember coming home the very first day because I was, taking the train, and I was like, this is not something I can do for my whole professional career because I felt like it was not aligned with the values that I have. Like, I mean, I'm not saying that it was, I don't know, not work that anybody could find valuable or anything like that, but it just sort of felt like, and what ultimately was what I experienced was there was just a lot of context. Like we were like working on things where it would be like something got a black box warning and it's like, what do you do to put on the black box warning so that people prescribe it? No matter whether the fact that maybe it's or like this drug is coming off patent, and we need to get people to spend more money. So how do we get them to buy this more expensive or more toxic or whatever it is? I'm overstating it, but I just felt like
That's how you felt.
but good for my soul. Like, and even though I think that I felt like everything was ethical and we told, the pharmaceutical companies what we heard, like if a doctor said, we can't prescribe this, we wouldn't prescribe this to our worst enemy. But then somebody else would say, oh, how do I do this? They're like, how do we find more of the people who say they'll prescribe it? It just didn't feel good. But anyway, this opportunity, one of my colleagues at the company I was at, he ended up leaving the company I was at, and she ended up telling me about an opportunity at SSRS. And that's how I ended up going there. And since I've been at SSRS, I've had the opportunity initially as a research director, where I was running projects and working really closely with clients on doing the research. Like that's where I came in and I, did a mix of a wide, different work working with universities and policy institutes and places like GWBI and the like. And then had the opportunity to develop into managing clients, managing client relationships, developing research, and also working ultimately with a team to do, a wide range of work. And I'm, lead one of the teams within our organization doing a lot of healthcare, public policy, and social science research.
Nice. One thing when we were designing our Master's of Public Policy degree, we felt that data analysis piece was really important because having those skills, I mean, just listening to your career progression, it seemed to, for me at least, to open doors. And it seems like that was that way for you as well. Is that what you found?
Yeah, I mean, I just felt like the it's funny that one of the things in my previous job that somebody who I was one of the senior people said is like, if you don't love data, if looking at data isn't, like the data that's been collected, if you don't find that exciting, like you're not in the right place. And I also feel like that's something that I brought to every, whether it's qualitative or quantitative, is like, whether or not we actually are delivering an analytic report to our clients or not, sometimes we do, sometimes we don't. Sometimes we work with clients that do that themselves. We always bring some analysis just to delivering the data because, first of all, it's another check on your data, right? Like if you're looking at your data and something doesn't make sense, then there was either an error or something, you realize something misunderstood or whatever it is, or you're like, oh, we assumed this, but lo and behold this, but now let's look at these crosstabs and let's look at, oh, wow, I thought that was odd, but now that I look at it, it's not as odd as I thought actually. And then I look at what's happening in the world. I'm like, oh, this thing that seemed odd, actually, maybe it's valid, and then we check all the other things and we're like, yeah, this is what the data say. It might not be fully expected. Maybe we'll dig in and understand more. Maybe, but I think, yes, I think that, yeah, you need, whatever you're doing, you need to care about data, and the more that you can care about it, not just from a technical, like I think the more skills you have from a technical perspective, that's great. But a lot of the analysis can be just from the perspective of really thinking about your data and what do you expect? What are you seeing? Does it make sense that, when you ask a question, that's a knowledge question that we often find that more certainty is expressed by male gendered people than female gendered people. That's a pattern that we see. So if it's not that way, we're curious about why.
Yeah, that's fascinating. Okay, you're bringing up some specifics, so let's dig into some of those. We are recording this during election season, so this idea of polls is coming up all the time. So you don't have to talk about election-specific polling, but will you talk about why polling and survey research is important in the policy world specifically, and what you see in the work that you do?
Yeah, I mean, it's such a great question, right? Because I'm part of the team that does training for new people that join SSRS. So one of the things we talk about is like, well, you know, polling and survey research and research in general, but certainly survey research, it's how we learn about people's attitudes, people's experience, people's behaviors. I mean, like the data that the government, uses to allot resources is based on surveys, trying to understand where are under-resourced and over-resourced places, crime victimization, education, healthcare, health policy, public health, all of these things. There's so much information that we learn from being able to do surveys. And nowadays there are other ways of, yes, collecting data and triangulating data and appending other information that we have. Absolutely. But there still doesn't, and people are even talking now about some of those AI enabled kinds of ways of like generating fake people to like learn things. But there still seems to be no substitute to, and you need, even if you have those things, the information that AI uses is generated from actually people, we're useful at anyway. But like, we just feel it. We learn, you might believe something. And this has come up. This is actually, I heard somebody present this, somebody from Harvard presented based on actually data that our team had collected. And it was related to things, not my team, but like SSRS had collected, but it was about things like attitudes around like work requirements and, and Medicaid and things like that. And it's like some of the, and he pointed out like there were certain assumptions that Republicans have typically, and there's certain assumptions Democrats have. And they were both wrong about certain aspects of this. And the point is that the data were really clear. And when you have those data, then you can bring them towards people in the government and say, look, this is what people are saying, and so say, we did a lot of work on, we worked with KFF on things about understanding things about contraceptive healthcare and reproductive, changes in reproductive healthcare. And one of the things that, has come up in our research isn't the only place, but a lot of research has pointed to the fact that some of the things that have come up are unanticipated, unintended consequences. Like you didn't necessarily expect that people would experience some of the anxieties and fears that they're experiencing in a current environment. Like that wasn't necessarily what anybody's goals were. And this is actually something I'd heard, but it wasn't from our study. It was from a different study, was like, wow, research that was demonstrating that people were choosing to undergo permanent, contraception in order to avoid potentially getting pregnant. They didn't want to get pregnant and they, whatever it was, but they were worried they'd get pregnant in a state that they were worried they wouldn't be able to get it. Now, were their fears well founded? I don't know. But the point was people that would have been advocates of, adding more children to the world, for example, wouldn't have as many people to get this kind of permanent contraception. But it's just these kinds of things. But you learn about them by actually talking to real people and asking questions. And you might have hypotheses about things. And I honestly don't know how, with the magnitude, how magnified some of these, how significant they might just be one-offs. But doing research, doing survey research in particular, gives you an ability to have statistical information, valid data, meaningful data that help you understand what's the magnitude of something. And is it confined more to certain populations than others, or certain parts of the country, or this, that, or the other. So
I think that point is so important because, we're studying the policy process, and the
yeah,
policy process, even at the local level, at the state level, if you're not even talking about federal level policy, it really kind of happens in a vacuum, right? These decision makers are in a room and you don't get those quick feedback loops. And so the kind of work you do helps your clients who are supporting this kind of policy making understand those unintended consequences that they would not have known otherwise. So
yeah,
that's
yeah. And we have the ability, to do some really quick turnaround things. Some things benefit from that. Sometimes you actually don't want to do that. And also the ability to combine sort of, synchronous and asynchronous data collection, sometimes both qualitative and quantitative, can be really powerful, because sometimes you want people to think about things and reflect on them before they respond to them. But it is really important, right? To not just, we're all limited. We're all going to be biased by what's in front of us. And, I'm always struck by the things that say, I live on the East Coast. I live outside Philadelphia, right? Like, there are things that are kind of commonplace and normal and, happen a lot here, but they're very different than what somebody reports in a more rural area or on the West Coast or in, the Midwest or wherever it is. So it's just that we all, we can't help but be affected by the limited personal experiences we have about the magnitude of things. Now, having real data gives you the opportunity to be able to understand better, sort of the magnitude and where some of the things might be disproportionately affecting people.
Let me ask you a technical question, if you don't mind. So, we talk about how all data has limitations, right? Clearly, all data has limitations, but that doesn't mean we shouldn't use data. And sometimes there is a criticism of polls or survey research that sort of like only the mad people or only the happy people take the survey. Can you just explain for students like why, while that may be true, we do have data methods to sort of normalize some of that. So can you go into that just a little bit?
Okay, so that I think is multi-layered. So I want to set aside for a minute, and I'm sure the people that are in your program understand this, that the one of the places where we disproportionately see something that might be affecting data in that way, like based on attitudes, there's definitely been some data that points to the fact that election polling, the horse race polling that's done is potentially more at risk for that in various different ways. Then there was a demonstrated, kind of reflection on this kind of shy Trump voter effect, from the previous election. That, and just these kinds of things that come up. First of all, the elections that are talking about projecting something in the future, which is the election, it's like you could be very accurate, but still wrong. Like, meaning like you could be within the margin of error, but like your poll, like there are all these polls that I'm in Pennsylvania, right? All these polls, like
Okay.
who's, I bet it's like it's within a margin of error right now, right? Like who's going to be winning, but somebody's going to win, and every poll could be accurate. But if the polls are currently saying, whatever, Trump is up by a point, but Harris wins it, there's 1,000 reasons why that could be the case that have to do with who happens to show up on that day. And all of the research polling has modeling built into it. It's beyond just waiting. It's like assumptions about who's going to show up and who's going to vote and this, that, and the other. So there's a lot of things that put those at risk. And that's often where people talk about that. But I think to your question about like the mad people or the happy people, I think that some of those things perhaps come up around the surveys that are, say, customer satisfaction surveys that might come up, after, so, I don't know, maybe Amazon does like a flash survey, something like that. And there you might think like, well, maybe they're disproportionately mad people responding or happy people. But the work that we do, most of the work we do, it's probability-based designs where people are not opting in. They may choose to opt out, like meaning like they may, we have non-response and there are concerns about non-response, the bias of the people that don't respond. And what do you do about that? But for the most part, because of the methods that we have in place, even with relatively low actual proportions of people that respond based on who we reach out to, we're able to address a lot of that in the rating that we do. So that we will renormalize. So like we know that certain populations, um, very off or often in the design. So we know that say, if you just do like a non-stratified design, like you just were to draw a random sample, say of addresses and you mail them out, we know that people that are less literate, are going to be underrepresented because we've mailed out an invitation. And so they're going to be less likely to participate. We know the people that might not be English speakers might be less, even if we offered in English and Spanish, whatever, there's certain people that might be less likely to respond. There might be, people that are more transient, might not, get their mail, or people in rural areas get mail less frequently. There's so many reasons that are reasons why we may see, we have kind of concerns about who's responding. But if we think about a design that says, hey, we're going to look at the geographies or the populations that we think are least likely to respond, and we oversample them. So we get a better balance already of the people that complete it. We're going to oversample. Oh, and we also know that, say, certain populations, we can more readily reach them on contract or what's called prepaid cell phones. They're disproportionately being used by people that are lower income and people that are non-white. So let's include that. Oh, and we also have at SSRS, and we have a probability-based panel of people that we have invited to participate in our panel, and we have a very good representation of a lot of people. So we're like, oh, well, we've underrepresented this population. Let's bring some people in from our panel to kind of get a more representative sample. So there's things that we can do in the design and in the sampling to kind of help create a more balanced sample. And then on the back end, there are things that we do to wait for that. Now, so places that are most at risk of some of the things you're talking about are more going to be what we call sort of opt-in or non-probability based designs, where there's a lot less control and your sample's already not representative because it might have been, like pulled together from people that went to a store or shopped somewhere or, saw some ad somewhere and they're like, oh, great, I will do this. There's a lot more risk in those types of things. Does that?
I love that. So that is perfect. And I think the phrase I want to hone in on for anybody listening is that probability based design.
Yeah.
And so when you're looking for evidence to support a claim, or like research says, looking at how the survey was designed and how the sample was created is the key piece to this.
Yeah.
And so that was a perfect explanation. Thanks. Okay, so our time's coming near the end, but I do want to circle back to a few personal questions. So, I told you this is for mostly for graduate students or anybody interested in policy. Any career advice you have for students interested in your line of work specifically, and then particularly around this influencing policy?
Yeah. So I don't know. I don't know that I thought about this specifically in terms of people that want to do what I'm doing, but I'll just give you some thoughts, right? Like we're living in a time of so much change, and certainly the research world is one of those places, there's as you sort of implied, like response rates are going down, we have to be thinking about how do we more creatively, hear from different people. I think the things that I think of as sort of just generic things, and they're not necessarily specific to research, is I feel like one thing that I've been really kind of increasingly conscious of is how important it is to like embrace failure and embrace challenges and really kind of put myself in a mindset of saying that, um, we have to be trying to create, we need to be more innovative. And in order to do that, we need to tolerate in ourselves and in other people, the idea that things are going to be hard, and finding our way towards something better means that we have to kind of accept the fact that it may not always work out perfectly. And that's been sort of as we've organizationally brought in more qualitative research, we're like trying different methods, trying different modes, trying different approaches. And we also talk to our clients about that. Like, we don't know. We're going to be here with you to try to learn from it and make it as successful as possible. But that means that the first splash of it might not, we might have to think and redesign and reshape and this, that, and the other. So I think kind of being open to that, I think, you know, again, because sometimes research is so huge, it's trying to kind of take it step by step and accept that, like, just, I think for all of us, we get, people get overwhelmed. And this is one of the places where it's like, well, how am I going to come up with the right design? And it's just so many different things I need to do. And you just sort of, you talk to different people, you try to learn from what other people are doing. And then you also sort of take these incremental steps. And, I think one of the other things I just sort of wanted to just say, kind of generically is one thing I've appreciated has been connecting with people, and learning from them. And that kind of brings us full circle to our relationship, Eva, because I feel like, you and I formed a connection many years ago and we've stayed connected. And through our relationship, I've learned so much. We share book recommendations all the time. We learn from each other. And I feel like through my clients and my colleagues, many of whom I've tried to build relationships with outside of my organization, in many ways, that's where I've learned a lot. And it's through through these relationships that I was able to, get on the board of a organization that I really believe in that, is helping to support Asian New Yorkers, specifically around, healthcare and housing and the like. So I feel like, and that was through a client. And that was after speaking with somebody a suggestion that came from various different people, including somebody who I used to work with at GWBI, so I feel like it's these relationships, I think that, and the other thing I would say is read widely.
Oh, yeah.
And that's also been something that I found, read widely, read curiously, and, think about, fiction, nonfiction, things of interest to you, business types of things, because I think they spark ideas. And as you know, one of the greatest books I've read in the past number of years is a book called Range. And it's about, it's how, I don't know what the subtitle is, but by David Epstein, but it's really about how generalists triumph in a specialized world. But it's really about this idea that, like, yeah, world is specialized. It's getting more and more specialized, but we have this opportunity to kind of, if we go with our curiosity, we can make connections across a wide number of different things. And that's often how innovation happens, where you think like, oh, this is happening in sports. I love sports. It actually relates to something I'm seeing in healthcare, And so it's sort of those connections, I think, they help build the creativity. I think they also help energize us because we sort of see things in different ways. So I hope that gets at least.
Well, that I actually think I read that book because of one of our conversations.
Yeah.
So that is a perfect
Yeah.
example of that connection you were talking about. Okay, well, this has been awesome. I cannot wait to share this. Thank you so much, Robyn. I will give you the last word if there's any last thing you want to mention to students or advice. No pressure, but I'll let you have the last word.
Okay, I appreciate that. All right, so my last word is really just about, I think one of the last questions you said to me is like, what advice do you have for taking care of yourself and your family on med work? And I guess I want to say, like, where I am in life, it's gotten clearer, clearer and clearer to me that, right, there are so many demands on our time and so many demands on our energy. And I do feel like I do need to constantly kind of bring myself back to what's important. What are my priorities? Where do I think, I can make a difference in the world? What am I here to do? And so part of that's about my work, and my work is about, I believe, trying to help my clients improve the world in some ways, improve healthcare access, help provide meaningful information to hopefully make the world a better place, right? So that's one piece of it. But I feel like for myself, it's realizing that, the things that are most important to me are about things that are meaningful, and my family, spending time with my grandchildren, being out in nature where I feel like I get um, ideas from, and I feel peace and calm from, exercising, walking, all the things that everybody tells you them, but the reality, and you have to find out what's good for you, right? Those are things that work for me. For somebody else, that could be just listening to music or something. But I think it's really trying to find those things and giving yourself permission, in the words of Brene Brown, to kind of like, take those breaks and say, I'm going to give myself permission to not respond to my emails, and I'm going to give myself permission to focus on one thing right now, or, accept the current situation as it is, even though I might not like it so much, or whatever that is. So I think that's what I've got.
I think that is an amazing way to close. I am going to ask one follow-up specific question. So,
Yeah.
specifically on the first thing you said, which is like bring yourself back to your values. Do you have a process for that, or is it just something you remind yourself of continually?
I mean, I feel like some of the things I've done a lot of different um, kinds of things that help me to kind of feel more connected to those things. One, look, I do try to journal. I do try to meditate. I do try um, to, I do a lot of self talk, sort of where I'll take walks and I'll be like, I'll find that I'm really caught up in something and I'm trying to like ask myself, why am I so caught up at this? Why does this bother me? Does it really bother me? Like, how much, yeah, I got caught up in this, but do I really care about this? How important is this really? Like, yeah, I'm envious because X, Y, and Z happened, but like, like, is this really important? Or, you know, um, I don't know. It's just, I find a lot of it is for me, it's sort of some of the self questioning, what do I really want to be doing? How do I want to spend this time? I've also done a lot of sort of time blocks planning and things like that. And trying to sort of start off saying, what are the priorities for me today, this week? And thinking about that proactively, like on Sunday, or at different points during the week and reflecting and sort of being like, what? And then I kind of make intentional choices because I'm thinking about that ahead of time. I've had to work really hard, as I think so many is, and I'm constantly needing to work at trying to separate myself from whatever might be the urgent thing that comes in front of me and trying to kind of think more broadly about letting go because we all just have a lot of things that will come onto our plate.
Okay, perfect. I thank you so much for breaking that down, especially when we're recording that, people may listen to this at a different time, but we're recording this in perhaps the busiest time for both policymakers and grad students, right? And so it's really easy to get caught up or feel overwhelmed. And so those are excellent strategies and a perfect place to end our conversation. So thanks for being willing to share that.
Thank you so much.
All right. Thanks for listening to another episode of Policy in the Wild. We'll see you next time.